4, 3, 2, 1.
All right. I'm going into your Facebook Live too right now. If you notice my eyes are somewhere else, I'm going there. Okay, here we go.
You're just going to have to mute one or the other, else it's going to be cross feedback.
Yeah.
So where are we? Okay, we're live now. Hold on.
Okay. Let me see.
How come it's not showing? Are we live?
Yeah, I see it.
And we're live, like.
Yeah, we're live.
Okay, so is your screen share on there or is it mine? It's yours, right?
Yeah, it's mine.
Okay.
It's mine right there.
Okay.
Okay.
So we'll just wait a few more minutes, and I'm also going to go on to the live as well, just to make sure I see people coming on. So and put on my live voice. Okay. Did you hear any feedback?
No feedback.
No feedback. Okay. Okay, so we're just going to wait a couple more minutes. It's 7:55, but Cousin Chris and I want to get on a little early to give everybody some time. And if you have any questions along the way, just either put it in the chat box on the live video, or if you're on Zoom, you could put it on the chat box there. I also will ask anyone to just, if you can, just do speaker view, so you just see Dr. Chris the whole time instead of me. If you do speaker view, then you're going to be able to see him while he's demonstrating all his videos. He did a whole bunch of great video exercises, stretches and things on video. I'm really excited to see them all. I only peeked at a few of them. So just bear with us. We've got about 4 more minutes until we start. I just came on live early so that people can have a chance to log in and see. So Chris, where are you now? You're in, you live in?
I live in Carl Place.
Oh, I thought you lived in, oh, you did live in Queens for a while,
Yeah,
right? Then
we lived in Queens for a while we were like just kind of settling in.
We're so close. Oh
Yeah, so we're due for a dinner and lunch several times right now, with family.
Yeah, we have to meet up. Oh my gosh, that's sad that we haven't all these years.
I know. Well, it is what it is. I think we were trying to get all our lives together. It's just life took over, and now all of a sudden,
Yeah.
like, oh my gosh,
You were getting your practice set up. We were doing like all these different things. So,
which is great. You're doing great with this.
Yeah.
I'm excited for you. I'm slowly getting my office back again.
Yeah, you got your office back again. Okay, so Nina asks, will this be recorded? I'm typing that it will be recorded on my Flourish page. I guess I should record it here on Facebook. I mean, on my Zoom page. But if it's recorded on the Flourish page or Zoom, I'm going to transfer it to YouTube. So for those that are watching on Facebook, it will be on my page the whole time. And for those that are on Zoom, I will also try and record it from here. Let me see. Oh yeah, I can record it both ways. So we'll give it another couple minutes. Like I said, I like to come on early because I want people to be able to get situated, grab a drink. I don't, like a coffee or a tea or water, and or a pad or something, and you could watch and listen, and we'll get started soon. What was I going to say? If you're just logging in, make sure you're on speaker view so that you can see Dr. Chris while he's talking about the videos. And it's not just, it's not everybody on your screen. And we'll get started soon. I'm really excited about this.
Yeah.
It's my first page, my business page, first video event and first video event with my cousin too. So very excited about this.
For those who are watching right now, and cousin or Dr. B, if you also have any questions, also, come up with them now, and then let's see if I could answer them as best of my ability.
Yeah, I'll watch on Facebook, and then can you see the chat box there, Chris? Like that when it comes up, a question comes up, I'll type one. Here it is. You see that?
Okay.
It pops up on the bottom or the side. I don't know where it is on your screen, but anyway, there's a little thing, a little icon with a message thing that says chat.
Chat. Yeah.
So anybody that has questions on the Zoom can put a question in there, and
Okay.
I'll watch that.
Okay, I see it now. Okay.
Yeah.
Oh, I see. Okay. We'll just
All
move
right.
forward.
So I'm gonna hit record, and then I'm gonna get started.
Okay.
Okay, welcome everyone to the Flourish with Dr. B page, first live video, and it's about spine health or back health with Dr. Chris and Dr. B. And Chris is my little cousin. I like to say we grew up together. His mom and my mom are cousins, first cousins. So we just call each other cousins. We don't do the first remove, second remove. We're just cousins. Everybody's cousins. So he's my brother and sister's age, a little older. So we all grew up together. And I'm really proud of him because he has this great practice in New York City. And I'm going to have him tell his story. But he has graciously agreed to talk about different stretches or exercises to maintain healthy posture and back. And at the end, we could take questions. And I'm also going to talk just very briefly about some of the products that Arbonne has to maintain healthy muscle health. So with that, I'm going to ask Dr. Chris to talk about his practice and his passions. He's in the sports medicine arena and also in martial arts. So I'm just going to let you take it away.
Okay, great. All right. So again, I'm Dr. Chris. I'm pretty informal, especially with a lot of folks and a lot of my patients too, just because I'm always hands-on. And as I work with a lot of patients, I'm pretty much at everybody's level. And I like to be comfortable. I like everybody to be comfortable with me as I work with them hands-on or even going through certain activities. I've been a sports chiropractor now for since 2011, 9 years now, and over 10 years as a chiropractor. I became a sports chiropractic physician in 2011, 2012. Just kind of a brief background what a sports chiropractor is. There are different types of chiropractors that specializes in certain fields. I specialize in physical rehab, similar to a physical therapist. I do work with a lot of sports injuries. That's always been my passion, which is why I came into this field. As a sports chiro, we of course had to go through postgraduate studies and a lot of training and a lot of exams just so that we could start working with Olympic athletes if we decide to do that. And that's one of my things. I've been a chiropractor now for about 12 years now. Had my practice in Midtown Manhattan across from the Empire State Building now for 7 years. Celebrating my 7th year anniversary in my office during the pandemic, unfortunately, but it is what it is. Glad to see how Manhattan's reopening too. So it's nice to see. What I do with a lot of my patients is not just sports related. Yes, anything injuries wise we work with, but a lot of the common things I work with are postural issues, work ergonomics type of issues, things from neck pain to lower back pain that are common things, shoulder issues that could come across from it to even wrist issues and knee issues. So things like carpal tunnel are some of the things I work with, from maybe directly or indirectly from work, from the desk. Especially now when we're all working from home, a good majority of Americans now, especially New Yorkers, are working from home. Sometimes the workstation isn't ideal. So for example, as I'm talking to some patients, sometimes I do telehealth medicine with them too. they're working on a couch, and that's not the best case scenario, but that's what they have to work with. Working with young adults, and they're working in small apartments with not a lot of space. These are all a lot of challenges that we're all coming across. And I know I'm sharing my screen here, but you can kind of see this little posture that I'm having over here. This is a typical posture everybody has. Not the best, but think about it even worse when you're, and maybe some of you are watching right now, you're hunched forward even more because you're on your laptop. So we're going to talk about those things too. What you could do, some ideal things that could make it a little better for you. Okay. So what Dr. B had posted up a while back, text neck syndrome. Well, you can see this. Can you guys see my posture over here, my mouse here? Obviously, this is a very common thing to see, and it's not a new thing, it's an old thing. I love the fact that people would say text neck because, yeah, that's what people are doing now with their phones or their devices. But there was an old article that I saw a while back in the 1940s where people lined up for the bus, and they're all doing the same thing with their newspapers. So in a way, it's really not it's not a new thing. It's actually an old problem that a lot of people are having. So think about it this way: your head. I'm pointing at my little coconut right over here. You know, your head roughly weighs about maybe 10 pounds or so. Now, if you think about how you're bending your head forward constantly for at least an hour, or for a lot of you guys, maybe 2 hours or 3 hours, think about those muscles in the back, always training to keep it, just to keep it up. That's why you're getting a lot of your neck strains. That's why when you have what we call a military spine or military neck, you lose this natural curve, which actually is like a C curve, and it becomes straight because you're carrying your head forward way too often. And that could cause a lot of issues, from the minor issues such as a minor neck strain, muscle spasm in the neck, to, believe it or not, herniated discs after a long period of time because you're causing a lot of compression on the neck, to even some other things such as rapid disc degenerative disease or osteoarthritis. By the way, I'm going to make a really quick, like just a bit of information. Osteoarthritis does occur to everybody, so it's not something that we could really avoid, unfortunately, but it's the truth. I know that when people sometimes sees another specialist or doctor, they'll say, "Oh my gosh, I'm looking at your X-rays, you have arthritis." Well, that's not a surprise to me because, well, we live in planet Earth. We do a lot of things. We have gravity, so we're going to have wear and tear. That's a common thing to have. It's the progression of that wear and tear, if I look at an X-ray or an MRI, where we might have to be concerned about. But typically when we see arthritis or I see arthritis, it's not necessarily such a big deal. And these are kind of things I would like to give people a lot of peace of mind too. So kind of going back here, we've got our text neck here, we're rounding our back, and I don't know if you could really see this whole area here, but this is your lower back here. Your lower back joins the same way as your neck here, where it has a C curve as well. And this same way as the neck or your cervical spine could create a lot of the muscle strains to disc herniations and a lot of tightened muscle structures too, which could cause you a lot of pain and issues also. All right. So the common thing that people are always asking me is, well, what's the best posture when I'm working on my computer? Well, number one thing I'm going to always say is this: we're human beings. We are mammals. We move. All right. We're really designed to move, not to be placed in a sedentary state. So I could talk about the best postural position in a few minutes, but the first thing I'm always going to tell you and remind everybody here is to get up and move as best as you can. Sometimes if you're in a meeting, I understand you're not going to be able to do that. Well, maybe in a Zoom meeting, depending on how comfortable you are with everybody else in attendance. But if you're working solely also on a project, you got to put a reminder on your phone. Maybe 30 minutes or every 45 minutes, just get up and move and stretch. And I'm going to start showing you a few things too on these videos here, which is why I screen share them too to you guys. All right. So first and foremost, make sure you move. Get up and move. All right. Whatever you're doing, put it down. Put a timer on your phone. 45 minutes or so. Get up. Now, when we're talking about posture in the work setting, and see how we're going to translate to the home environment also. Rule of thumb, and I'm going to demonstrate in this video, you want to have it where it starts from the bottom up. Your seat should actually cause your pelvis to be a little higher or at level with your knees at minimum. The reason being is it's going to force your body to be a little bit more upright. When you do that, now we're going to follow suit. We want everything from like the keyboard area to it's going to have your elbows about roughly 90 degrees to where you're seated. Now, this is the best example, and this is why I tell my front desk personnel to also stand up too, if the best they can. But when you follow suit here, that monitor should be also at eye level too. So you're really kind of upright this way. You're not hunched forward this way. You're upright. Okay. That's one of the most basic things I go over too. If you're working from home, and there's certain things that you could try to fix. Let's say you're working on a couch. By the way, working on a couch is not the best thing, but if you are forced to work on a couch, same principle goes. Make sure you try to see if you could create the seat, the bottom of your seat to raise higher, whether you put some pillows or cushions over, get your pelvis higher, at level your knees. If you have, now this is if you have this, maybe it's a good thing to purchase. It's inexpensive, but if you have a table, like a coffee table or a desk table that's portable that you could actually roll up to you and have your laptop as best you can, keeping your arms at 90 degrees, that's great. Of course, the only problem right now is that your laptop screen, you're bending down. So again, if you have an extra monitor that you could connect to your laptop, that would be ideal. The other thing too is placing the laptop on the table or a countertop, which you could do all those same advice too. All right, those are the common things that I usually make my recommendations in terms of your workstation. And once again, I'm going to remind folks to get up and move. Now, if you could just have some patience here, I'm going to actually play this video here. I may stop it from time to time and just talk about it. If anybody here has any questions, let me just see here if I could get this. Don't hesitate to put something on chat, and I'm more than happy to answer them as best I can. So I'm going to play this first one for you. Hi, so I'm Dr. Chris here again. Just kind of give you some pointers on a few things that you can do for yourself, especially at this time, whether you're working from home or even now re-entering and working in the office. A few things that is troublesome for a lot of folks is when you're working from home, you have a tendency to, especially working on a couch, the laptop, you have a tendency to crouch this way. So if you can help it, if you could actually change a little bit of your working condition, try to see if you can set your laptop to an area or a table where it actually lets you have your hands and your arms almost at an 90-degree position this way. Other things you can try to do, if you could help it, is find a chair where it actually lifts up your pelvis so it's actually above your knees. That way it forces your whole posture to actually be upright. And of course, if you could help it, connect the laptop to a monitor, try to get this straight about roughly at high level as well. That way it helps force you to be in a good posture. Now, going into the office, same thing. You definitely have a chair which actually lifts your pelvis above your knees, or at least at level. That way it actually helps you to get your posture upright. Keyboard, mouse, also at roughly picture 90 degrees, also monitor at level. So, okay. If you like, you can also place a pillow under your behind your back to help some back support too. Key thing though, you need to give yourself a break. You need to give yourself a break every 45 minutes or every 30 minutes you can. You stand up if you need to, and stretch out, which we're going to go through as well. Okay? Momentary breaks is going to be helpful for not only your posture, but also for your eyes. Eye strain itself is going to lead to a lot of different things as well. Headaches, eye strains, and talk to your eye doctor about that. Okay? And we'll go over a little bit more some posture exercise. So again, just to reiterate, a few things you can do when you're at home. If you could help it, try to stay away from the couch because it's going to get you in that crotch position. It's going to hurt your whole posture in your back. If you can, maybe put some pillows underneath your pelvis. See how your pelvis is at level or a little higher than your knees, which forces your posture upright. Set your laptop or your keyboard area to be, again, keeping elbows at 90 degrees. Have a monitor. You could help it. So we also have the same thing Also, if you like, place a pillow behind your back, help your back as well. And of course, the biggest thing, put a timer on your phone. Every 45 to 30 minutes if you can, stand up, stretch out, walk around. Movement is a very big key right now. Being a stationary position like this for hours at a time. Any other questions? Always also consult your healthcare providers, especially chiropractors, physical therapists, for example. Give you some good pointers as well. So speak to you soon. Okay. How do I get out of here? Okay, so you guys have a little bit of patience there with my video. So obviously I'm emphasizing a lot of those breaks. That's one of the key things here. Let me just see who's saying anything here. Can video volume be higher? I will be able to post this before when it is done. All right. So everybody here, I know the volume is a little bit off right now, but the key thing I just mentioned also with the whole video is really the demonstration of how the posture should be, how your seat, your chair should be, how your pelvis should be, how everything should be situated. Again, that is also in a perfect environment and a perfect world. If you can't help it, do the best you can, but also take those momentary breaks that you need to. Okay. Does anybody have any questions as of now? If you want to put it on chat with regards to that. I'm going to move on into some other stretches and exercises already. That's going to first start off with the neck and then going into the lower back too. I'm just going to give you a little bit of time. Okay, nobody, I think. All right, so I'm going to move on. And guys, feel free to stop me also. If I understand the volume may not be so great, but I'll do the best I can here. So the next thing we're going to talk about are some needed. Oh, I got a question. Hold on. The volume is great now. Okay, good. All right. Okay, so what I want to talk about now are some. Well, okay, now that I'm up and moving, or I'm giving myself a break. What am I going to do? Well, my neck's hurting. A lot of common causes for headaches, I'll give you a perfect example, are those tension headaches. Tension headaches are mechanical, and they could be sometimes mistaken as migraine headaches, especially if you're doing this job for a long period of time. And not to really get into full detail with the muscles here, but typically the muscles here right in the base of your skull, traveling all the way down up to the beginning of your shoulder blades, when they get strained as you're carrying your head forward for a long period of time like this, think about it. Think about holding a dumbbell for a long period of time. You're going to get tired and your muscles are going to get strained. It's the same thing. So what's going to happen is those muscles tighten up, and they actually develop to be that tight for a long period of time. You're just creating that bombardment of reinforcement over and over again. Over time, when those muscles get tight, they actually create what we call trigger points, where they get sensitive in certain areas, and sometimes those trigger points could travel in different areas distally to different parts of your body. For example, this muscle right here called your levator scapula, or these suboccipital groups here, when they get so tight, they actually create that pain right behind your eye, one-sided. Sometimes it's mistaken as a migraine headache when it actually is a tension headache. Now, I don't mess around with headaches. Headaches could be a lot of things, just like stomach issues, which we'll get into, but or you can get into something else. It's not something I take lightly. If it's something that's chronic or constant, sometimes you may need to see another healthcare provider first, like a neurologist, to make sure it's a true migraine. If it's not a migraine and you're still getting it, more than likely it truly is a tension headache. And those are things where we could pinpoint, whether it's a chiropractor, a physical therapist, an osteopathic doctor who does specialize in musculoskeletal health. These are all things we could pick up and see, hey, it's a tension headache. So what happens is, and we're going to get into different types of treatments that could be there, from conservative to less conservative, but when you're carrying your head this way, that could create all those headache issues. That could also create tension to your jaw. If you grind your teeth at night, or you constantly grind your teeth during the day, guess what? Those jaw issues, TMJD, temporomandibular jaw dysfunction, also creates those headaches. Couple things too, and that's why I work a lot with other doctors too, with eye doctors. If you're constantly getting headaches and you're constantly straining at the screen, that's something you might also want to consult with an eye doctor also, because that could create those issues too. So we're talking a whole different aspects of an array of things that could happen based on this posture alone. All right. So one of the things I like to do is our chin tuck exercises, and I'm going to demonstrate this here. I can actually do it here, but again, I did it on the office, so kind of give you an idea, a little bit more realistic feel. So bear with me here. Let me see here. So one of the things I want to talk to you about as well is your posture. Now, if you're going to be working along in the computer at home, especially since we're in the quarantine or pandemic phase at this point, our necks, upper backs, or shoulders, our lower back is going to start hurting us and giving some aggravation. I may have shown it to you or shared it with you as well with some good needed exercise for your neck, chin tucks especially, first of all, straight ahead, taking that spot on the wall. You can use a finger as a guide, and you can just go ahead and push it back. Without a finger, that's going to be. The whole point again is to help cause traction to your neck, help avoid that hunched over neck swell that creates what we call a military spine or a straightening of the neck. That helps with your posture, that helps relieve the tension in your muscles eventually, also creates strength in your muscles. There's another key thing that you can start doing. It's called the Brugger's position, open the chin tuck. Now, you can actually do this while seated and standing, which I'm going to show you in a second. Seated position. Now, remember, I talked about giving yourself momentary breaks every 30 minutes, 45 minutes or something, okay? So, as a break for a few seconds, you can actually put your, try to sit on the edge of the chair. Go ahead and do a chin tuck, hold there. And what you can do is you can raise up your hands slightly. Don't try to raise it up so much that you're actually crouched down, turn up your shoulders. Just keeping yourself in control. The important aspect too is separating your fingers and extending them. That's an important neurological thing. And the biggest thing here is as you're doing a chin tuck, pull back your shoulder blades and down. Okay? This is the Brugger's position we're talking about. Hold this in the very beginning for about 5 seconds. Good. 5 seconds, 15 seconds, and hold it 30 seconds at a time. As we're done, you go ahead and just slowly get into your posture. Get yourself a drink of water, get yourself a bathroom break, go back to work. Just give you a nice reset of your posture, okay? That's seated version. Standing version is no different. All you need to do, stand, chin tuck, arm straight out, back up this way. Okay? Separate your fingers, extend them. So, and once again, I'm going to show you from behind, back, and down your shoulders. Just like so. It look a little weird, but it's actually going to be very helpful for your posture. That way, avoid that full slung posture that you're getting everybody straight. 5-second hold for 15 to 30 seconds. Hold it up. Again, once again, slowly releases your posture. Okay? That's pretty good. That's a good reset. Okay? So 2 things, seated or standing. My preference, I like to stand because you know why? Yeah, I like to incorporate movement. Go ahead and stand up. Okay? Any other questions? You can always consult your healthcare provider. All right, we went over that. So let me get back into here. So we just did what we call Brugger's position. I'm going to put that on chat right now. So if you guys are studious and like to take notes, you can do that. Brugger's position, chin tuck. Now, when we do a chin tuck, I don't want you using your finger to push down or up. You're keeping yourself in a nice sagittal plane. You're bringing your head back. Okay, I know it looks silly. I'm going to explain to you why this is important. Okay, now we're going to raise up our arms just slightly, like you're making a T. Separate your fingers, extend them, and then pull back with your shoulder blades and down. Okay, you want to open up your whole thoracic cavity here. You want to open up your pecs because we're doing this for such a long time. You're starting to create tightness, myofascial adhesions, being fibrotic. You don't want that. You want to make sure you open up your posture this way. A very good way to do it. You don't need weights. You don't need resistance bands. You could just use the strength of your rhomboids and your mid-traps to pull back on your muscles. That's a very key thing. And the chin tuck, the reason why it's important, and I'm going to emphasize this, it's, think about it. Yeah, you're trying to make a double chin. I like to make that joke just because it's a little easier for people. But honestly, you're creating strength on these deep neck muscle flexors right now. Hey, bud. I'm doing a Zoom meeting, buddy. All right. So I'm doing, what I'm working on are the deep neck flexors here because you want to create strength over time as you bend forward this way, they become weak. And eventually this is going to take root. So a lot of folks like to say, well, you know what, when I see my grandma, my dad, my mom, then they're, you know, being progressive in age, they're like this already, I don't want that, I don't want that hump or the Dowager's hump. Well, the reason being is they're like this over time. Obviously there could be other underlying causes too, but this is something that's going to help you out on the long term. So chin tucks incorporated with the Brugger's position. You could even do the chin tucks sporadically, so often. And I do this throughout the day, whether I'm working on the patient or I'm doing notes. I have to, because I'm also falling to that same fault of poor posture. Okay. Anybody have any questions so far? I'm hoping you guys are able to understand this. Feel free to put something in chat or so. Are we good? Okay, awesome. Okay, so next up, I'm trying to go through as methodically as I can here for your lower back. So now we covered the neck, upper back region. We're gonna go into more lower back. Hold on, let's see. Okay, how do you release stiff neck? All right, that's a good question. All right, so I'm gonna do this here. All right, so if your neck is getting stiff, you know, if it's just like a normal, like how it hurts a little bit, there's a lot of different things you could use. You know, a simple strategy that I like to do, besides doing the chin tuck movements also, you could do a nice simple stretch. So a simple one, I'm gonna try to do what I can here as best I can here on the video. But what I like to do is, let's say the issue is your left side of your neck. You wanna grab you wanna put your left hand behind your back. Matter of fact, who is this? Miss CT? If you want to try it on your own, you can follow along too, okay? Put your hand behind your back. You're going to grab your left hand with your right hand, and this is what you're going to do. You're actually going to pull it downwards to the right at a 45-degree direction. You're going to pull it. You're going to create that nice traction onto it. And you're going to actively stretch. I'm going to lower down myself here so you can see me. And you're going to bring your head down to the right this way. So you're actually actively stretching your neck. The pulling creates that nice traction to your muscles there. The other thing that you could do is you could actually sit on your hand. So you're gonna go to the edge of your chair. You're gonna have your palm on the chair. You're gonna sit on your hand. Now I know that sounds silly, but what you're doing is you're also causing natural traction that way. So we're still talking about the left side of your neck. Your right hand's gonna go on the left side of your head, and you're gonna pull. Now with this, you could be a little, if you pretty much have this, you could be a little more slick about it or smooth. You could actually turn your head downward to the right, get the upper traps, and you could actually look upwards too, to the left, to get the other portions of the levator scap. Okay, that's a good way you could do some simple stretch movements also for your neck. If you really are having stiff neck, that's something you might want to have a healthcare provider take a look at also. So if you're really having a hard time and that's painful, and trust me, I actually see this a lot during the summertime, and I'm going to get that into a second, you're going to need to see a healthcare provider if you can't find relief. So let's say you took any type of over-the-counter meds. Warm showers also helps too with it too, but it's not getting any better. You might want to have somebody take a look at it. Now, the reason being, and I said summertime, a lot of times I do see this, is because, well, during the summertime, we have the air conditioner blasting right by our bed. The windows are open right by our bed. Fans running by the bed. Cold air to expose skin creates your muscles to tighten up, just like any cold thing. So what happens? Your body naturally tightens up. And if you're spending a lot of time on the computer every day, all day, and then you have that, it's a perfect combination to create what we call a torticollis, which is a stiff neck. And, you know, again, sometimes these help. Light massages that you could actually go on the top part of your shoulder blades there too might help. But if it doesn't get any better, you're gonna have to see a healthcare provider for that. All right, whether it's a chiropractor, a physical therapist, or a medical doctor. How to use? Good. I hope that answered your question. So you could try doing that. That's another strategy. I didn't put that on the film here, but that's something I could show you. Okay. Good. That was a great question. Does anybody else have any other questions? No? Okay. Great, really good to know about the cold air too. Yes, yeah, absolutely. Yes, that's why people like. That's why, to be honest with you, when I see different injuries throughout the year, when I see a lot of knee injuries, I see it right after winter because people are trying to go back into shape and they run. When I see stiff neck, well, it's because of the summertime, because of all the air conditioning and so forth. So there's a lot of things when I see shoulder injuries, it's during wintertime because people are carrying a lot of things and lifting a lot of things and shoveling snow. So these are all things I see different times throughout the year. Okay. All right. So let me get into the lower back. Now, the lower back is complicated. We are using it a lot. A lot of our weight's going down to our waist. And again, this posture here that we're having here, that I'm kind of pointing out to you. All right, we've got that slouch position. Not really good. Why? Well, with this position, especially if you twist downward in certain ways, that over time that could actually wear down the discs. Now, what are discs? Those are intervertebral discs. Those are cartilage structures between your vertebrae. They actually help provide support for your spine, but they really can't withstand a lot of that heavy torsion over and over again. That could sometimes lead to injury. So hence why bending down and picking up a pencil, but I dropped it off the table, and all of a sudden I'm feeling a lot of pain. Again, those are typical injuries that I see, especially from the lower back. Big thing that I talk about again, what do we do? What's the number one thing that I tell everybody to do when they are working on their stations? Get up and move. Get up and move. Those are important things. And I'm going to start showing you also some other strategies that you could do if you're working from home and you obviously can't go to a gym that could help straighten your spine. But I'm going to go ahead and play this video right now. So bear with me here. There you go. Oh, hold on. Somebody has a chat. Hold on. Okay. You're welcome. All right. Nope, that's not it. That's another segment. Okay, so you're spending some time, you're doing a lot of work. Okay. A lot of work at home or at the office now, and you're getting some lower back pain. Most likely, you're doing this for more than an hour or so. And now you're feeling it here. Now, biggest thing is if you're getting a lot of back pain, you got to look out for a couple things. You get numbness down your legs. You get any severe pain from a scale of 0 to 10. You really need to be judged of that. Things like those you really need and should consult a healthcare provider, whether it's a chiropractor like me or a physical therapist or a medical doctor. You want to know your options here, okay? Again, you want to go with a conservative approach. A couple things you can start doing though to help you with your aggravation. If you are seated and you're getting a lot of lower back pain, probably 70 to 80% of the time is because of the fact that you're overly seated forward this way, you be bending down this way, which is definitely not a really safe move at this point, especially for your back. What you can start doing are some extension type exercises, all based off what we call the McKenzie boat. Right? So a couple things you can start doing. First of all, make sure you stand up. Make sure you give yourself some time every time throughout the day to give yourself a break. Again, 30 minutes or 45 minutes or so. When you're taking that break, you can stand up. If your back is hurting, get your hands small your spine. Okay? But you're just going to go easily and just very simply and back to where you can tolerate. Swing yourself up to a nice neutral spine again. Back. Okay? This is a very simple exercise, but a very powerful one because it does help relieve a lot of back pain. A lot of disc patients that I see every so often. It does help relieve some of the symptoms that may be coming down, traveling down the leg. So again, up to where you can tolerate. It doesn't have to go all the way back. Something where you're comfortable with it, even a small amount of degree, that's okay. Just treat yourself up. Okay? Back. And I usually prescribe maybe a set of 10, just beginning, sometimes 3 sets of 10, just as we're patient with this. Now, if you're noticing pain traveling down the leg and it's getting more intensified, I'd like you to stop. Definitely might need to consult a healthcare provider. Okay? Again, these are some things that you can start doing on your own. Again, about roughly 70-80%, this does help with a lot of lower back issues. If you have questions, definitely consult a healthcare provider, consult a chiropractor like myself, or a physical therapist. They will all definitely be able to help you with many different approaches. Again, conservative care is one of the most the first chiropractic first before any types of medication. If you need to, you can definitely look me up at haroldssquarechiropractic.com. Okay. Had to put that in there for a second, that plug in. All right. So I just saw from Facebook Live that, yeah, so for folks, and you're not one of, you're a lot of folks like that, whether you're driving or commuting, an hour and a half, maybe 30 minutes, this is actually a great way for you to truly expand your spine, extending your back, and relieving your pressure. Because no matter what, especially a car, especially a train, subway, bus, anything, you're going to be right on your back like that. Now, that's about an hour and a half worth of traveling. Now, spending another 8 to 10 hours at the office doing the same thing, you're hurting, no pun intended, for trouble. So that's why this move is actually taken from the McKenzie protocol. Dr. McKenzie is a physical therapist. This is something that is standard for a lot of folks for lower back pain. I do this a lot with disc patients also. It's very simple, but very, very effective. Especially the fact that you can do this anywhere. You can literally do this at home, at work, not in your car necessarily, or maybe not where you're traveling, but as soon as you get out of it, you could start doing that just to loosen your body up, all right? The theory behind that too is that if there's a truly a disc issue, and I'm going to get into that a little bit more, but when you have a disc issue, let's say you have a herniated disc, not to get into full detail, but it could actually encroach or irritate some of the spinal nerves going down your leg or your spine, and then you're going to start feeling the pain or numbness down your leg. Those are things that we consider or possibly might be a disc issue. Doing that a lot of times helps relieve those disc issues. Of course, we need to really evaluate a lot of that too, okay? So that's standing extension. If you want to go into more detail, there's other things that we could do too, such as a prone extension. So I'm going to get into that right now. But before I get into that, I just want to make sure everybody, does anybody have any questions? I'm also looking at Facebook Live too. And I just hope that, I hope Miss Marie, if you got that information there, you can start doing that also. I don't mean to amaze there. Okay, so another thing you could do, I'm going to demonstrate it on one of the treatment tables. You could do this on the floor, preferably with an exercise or yoga mat. Not a great fan of using the couch or bed, but if that's all you have, then that's fine. You could do that, but preferably a firm surface. This is the prone extension. So I'm going to get into this right now. Expand that video.
Hi, it's Dr. Chris again. So, let's say you are hurting back pain and you're home.
Hold on a second.
There's
Sorry.
a lot of different options here, whether
my computer is being okay. All right.
Depending on the size of your space or not, you can definitely do this. Just to kind of go back to this again, you can do what we call a standing back extension, such as this. These are all taken from the McKenzie protocol technique. Other thing you can do to help enforce that, you can actually go on your stomach, whether you're on a mat or exercise mat, yoga mat, or floor. If you have no other options, then you can do in your bed, that's fine. But however, the bed definitely loses its firmness. You want something that's a little bit more firm. That's really recommend. But in all sense, if you need to, you can do that too. Go ahead on your stomach. First off, you can definitely try easy. Get your pelvis on the table, on the floor, nice and relaxed and loose. And you can actually hold yourself up this way, with your elbows or your forearms, just like you're looking at reading your phone. Nice and simple. You can hold this, about a couple minutes, maybe 1 minute to 5 minutes, sometimes 10 minutes if you can tolerate it. This helps ease a lot of your back pain. Other things you can do, we call a prone press up. Taking your hands right by your shoulder level. You can go ahead, just use your arms, not your back muscles, just raise yourself up to where you can tolerate, and down. Now, you don't want to do this where you're lifting up your pelvis. No, no good. You want to make sure your pelvis is on the table. And again, you're going to lift it up where you can tolerate, and bring yourself back down, up again, down. Okay? You can even rest by putting yourself up prop yourself up on your forearms. Typically, I usually recommend maybe a set of 10. In the office, after treatment, we do about 3 sets of 10 at the very beginning. You obviously change things up. Now, the biggest thing I'm going to say, that caveat, is if your pain intensifies, I'd like you to stop. If you're feeling pain shooting down either legs or both legs, you need to stop. This is something where you definitely need to consult with your healthcare provider, such as your chiropractor, medical doctor, or physical therapist. that needs to be fully examined. It's not something that you necessarily fix on your own, which is unfortunate. But these are some very basic things you can try to help alleviate some of the postural lower back issues that you might be experiencing, especially at a time like this when we are forced to work in a very uncomfortable position. Again, these are something we can try to do on our own. Definitely, it has been very helpful for a lot of folks here, but again, consult with your healthcare physician just in case if symptoms don't improve. Once again, I am going to emphasize, as you're doing this, you should be doing this to where you are comfortable, where you can tolerate pain-free. The more is not the best. Less is best, if anything. So once again, if you find yourself looking at a lower angle like this, don't feel bad about it. That's fine. That's where you're comfortable. You're going to continue doing this over a period of time that help with that motion. And I'm going to emphasize too, this is not a strengthening exercise. This is more for mobility and to help stretch out certain muscles and ligaments in your lower back. Theoretically, it also helps with if there's a disc issue or a small disc issue. It helps imbibe or bring that damaged tissue back into the disc here. But again, this has been very helpful for a lot of folks with consulting healthcare provider. Yeah.
Okay. Let me see if there's anybody have any questions. I'm going to get into that in a second too. Does that help strengthen the lower back? Okay, yeah, like I said, this does not create strength yet. This is more of a mobility exercise. It's more of a stretch. So for those who practice yoga, like I commented on Facebook Live, some folks like to call this the Cobra. It's there to help with relieving tension in your back. Strengthens, not strengthens, it stretches a lot of the muscles and ligaments too. And if there possibly is a disc issue, it does help get that inflamed part of the disc to kind of suck right back in. That's a theory behind it too, all right? I'm going to emphasize too that as you're on your stomach, as you're lifting yourself up, don't fire up those muscles in your lower back. Just let it relax. Let your tummy on the table. It's your arms that's going to do the work. You might as well tone up your arms while you're doing it, right? So, you know, that's a great way to do it. So keep your body nice and loose and relaxed. If you're starting to get tired with doing those press-ups, you could just go ahead and prop yourself up on your elbows and your forearms comfortably. You know, if you want to get your laptop there, yeah, do it. If you want to just chat on the phone for a little bit, that's fine. Check your email. Yeah, that's a great way to kind of help loosen up the back too. And of course, get up, move around. When I have patients do anything, I have them move around to kind of test and feel, see how it is. If the pain, now here's the thing, if the pain increases, I'd like you to stop, like I said in the video. If you're starting to feel pain shooting down your leg, please stop. That's when you need to talk to a healthcare provider. It could be more that's happening too, all right? So I'm gonna make sure I emphasize that too. But for the most part, 70 to 80% of the patients I see who do this, they get better, they feel better. And that's something that I'd like you to try also. So for those of you who are traveling, commuting for a long period of time, and spending a lot of time on the computer or the couch, this is something you want to do. By the way, the couch is a terrible place. As comfortable as it is, it's too soft that it's not actually firm enough to support your spine. So if you notice that you're watching a movie, you're watching the game, watching something, watching Hamilton, for example, for like 2 hours, and all of a sudden my back's hurting me. Well, guess what? Because your couch really doesn't help you. It's not. It's actually perpetuating that whole reverse curve of your lower back. So that's something that you might want to try, especially for streaming movies or watching sports now that sports are going to start coming on. Get up and do those extensions. That was yesterday. Yes, I know. So, well, not no, but a lot of folks are going through that. Okay. All right. So anybody else have any questions? I hope I'm going through it nice and easy, simple enough to follow through. I'm going there. All right. So next thing, I want to make sure we have enough time here. I don't want to lose time here too. All right. There's other options. If you notice that extensions hurt you, this is the other option, another move that's reversed that might help you also.
So, hi, it's Dr. Chris again. So, all right, a couple
Come on and go.
things. You notice that extension this way or the press-ups like we talked about earlier hasn't been helping. Maybe one of those few people who might respond better to what we call a reflection, all right? People are different. There is no cookie cutter solution for a lot of things. This is why we have to examine a lot of things to figure out what may be the best movement, positioning that can be helpful for a lot of folks. So if anything, we could do some flexion type of exercises. So things that you could try doing. If you can help it, especially if you're home right now, you probably have more options than this. You can lie on your back. Now, this is very important. If you are lying on your back and you have back pain and your legs are straight, definitely bend your knees are ready. Okay? It takes a slap off your lower back. But you can do this. It's called a knee to chest exercise where you actually bring both your knees for about 5 seconds or so. Momentarily release. Then back again. Now, this is about roughly 10 times. If you notice that your symptoms are improving, well, that's a green light. Definitely go ahead. 10 times, maybe 3 sets of 10 or so throughout the day. Again, every 35 minutes or 45 minutes, take a break. This is something you can do. Another alternative, pretty much same principle. Maybe one knee to your chest. If back pain is really aggravated, you can do your knee slightly bent, and the other knee, back and forth. The theory behind that, it also helps with bending or tractioning out the lower back itself, the vertebrae. Also with stretching some of the muscle ligaments and theoretically imbibing back the loose material of the disc that might be injured. Again, these are all certain things that has helped over time for a lot of folks. Not every movement's the same for everybody. Everybody's situations and their bodies, symptomology, they're all different depending on certain cases. But you definitely try these at home. Definitely gonna be a little bit harder when you're at work. Now, the next move I can show you that could be as an alternative, you're sitting down, I can definitely show that again for some sort of flexion exercise. I'm not necessarily opposed to this, but when you really experience a lot of back pain, I know a lot of people like to bend forward this way. That rounding of the back tends to also aggravate it. So let's try to avoid that if you can. Once again, if there isn't any other questions, you should really definitely consult.
Okay, I know. I plug that in all the time. So let me move that out. Okay. Well, I think there's a question here. That was yesterday. Are these exercises good enough to lessen the need for frequent adjustments? Yes. Actually, yes. Absolutely. Okay. I'm not opposed to adjustments. Obviously, I'm a chiropractor. I believe in them. They're great for creating motion into your joints. Not to be too over technical, but it's creating basically a deep stretch into those muscle fibers as we do those adjustments into your joints. It also activates another nerve response that helps numb out pain. I don't want to get into that either, but yes, these exercises also help. After I do an adjustment or even manual therapy, soft tissue work, I may not even do an adjustment. I may just go straight to this exercise just because it's actually helpful. If I have a patient coming in with a lot of pain, guess what? I may not even touch you. I may actually have you just go ahead and start doing this and see which movements work, whether it's the extension or that knee to chest flexion. So answering your question, Nina, yeah, it may. I don't personally, I do see patients who like maintenance visits or so from time to time, that's fine. But I have a plan for a patient. I always go with the goal. If we want you to be out of your pain and going back to what you were doing, that is something what we want to do. We eventually taper you down so you could do things on your own. And that's why I'm showing this to you. So you can do a lot of things on your own. Something that if you could help it, hey, I'll do this right now. Save my time going to see the chiro or PT. Not that we can't do anything, but obviously if this is something you can fix, perfect. Okay. Let's see. And again, I'm going to say this again. If any of these movements cause pain, and you have to be a really great detective at this too. You have to really pinpoint a lot of things. If you can, do so. Write it down. Put it in your phone. That way, should you need to see a doctor, this is a great way for us to figure out what's happening. That way, there's a better course. There could be a really good course of treatment. So, good question. Okay. I'm going to show you. I want to I know I don't want to run out of time here, but I want to show you some other things here too. There's another chat. You're welcome. Okay. So for those, let's say you're in the office and you can't go on your back. All right. Obviously, that's a little silly. This is something that I've also done too with folks. If you're seated.
Hi, it's Dr. Chris again. So we're going to go over another type of movement exercises. It's called the pelvic tilts, whether it's posterior going back or anterior going forward. This can be a little tricky, but this is something that is usually guided by healthcare providers such as myself, or physical therapists, chiropractors, trainers, for example. The purpose of this is to help create more motion into your pelvis, and it also gets you into more of that what we call neutral spine when we get into more core exercises with core, which we can get into in a bit. Okay? So first thing, rule of thumb, you can do this on your back. That's how I usually have my patients do this. You also do this standing, so it's more functional. So a couple things you want to keep in mind. Your pelvis, okay, should rock forward and back. These are all, that's a key function. I usually have my hand just to demonstrate right on your hips. And let's say we're going to go do an anterior pelvic tilt. We're going forward. And basically what we're doing is we're trying to get this whole pelvis to, think about it as a pitcher of water. You want to pour forward this way. Now, as I'm doing this, I'm just exaggerating here, but typically this is what I'm doing. I'm creating an arch in my back. Okay? It's no different, not that different from extending either. So you want to create that arch. Now, the next step is to bring that pitcher back by rolling it back. Okay, so again, I'm going to go forward, I'm going to roll it back. Okay, as I'm doing this, we're actually flattening out our back a little bit more. You might feel a little bit your lower abdominals engage as well. You might even actually feel your lower glutes fire up as well too. Okay, so rolling forward, rolling back, nice and easy. We're not trying to really necessarily build muscle here or create tension. It's just a nice and easy motion of your pelvis. Now, I like doing this, especially if you're sitting down a lot. Let's say you're in a car ride or you're home. And again, I'm going to...
Oop. That was a long video. Let me go back to the second part. We can go over that too. That's a little bit tricky, the pelvic tilts. But let me get into this.
Say this. Try to get up as often as you can. Maybe 30 minutes or 45 minutes. But let's say you're seated, you're in your computer. Again, typical thing, you're hunched over, not a great thing, all right? But again, we're human beings, we always change our positions. Changing your position. So, movement, go to the edge of your chair. You can put your hips here, the same thing as we get it standing. Then you can also mimic that rocking motion of your pelvis. Forward, back, forward, back. And you're also going to kind of feel which area feels better for you. That's actually a key and important thing. If you notice that you're going forward and it feels better, hold it there a little longer, or pull it back. It feels a little better, you can hold on a little bit, you can hold it there for a little longer too. If you're noticing pain at a certain moment of angle, let's say you're going forward, it's painful, then same thing. Rule of thumb, I do this in comfort. So avoid that area. Go forward, but stop before discomfort exists. Same thing going back. Stop. If you're noticing pain going back, stop before that pain exists. The more you do this in pain-free zone, the more you're going to notice you're going to start getting more range of motion back, which is a key thing. Okay? So to reiterate, tilting going forward, going back, forward, going back, standing, seated, going forward, going back, forward, going back. Other things that you can do this lying down on your back, or you can even do this by standing against the wall. Let me get my focus here again. And you can actually have your hand as a gauge here, right up against the wall. And if you notice, just say going pelvic tilt forward or anterior, you should feel, going forward this way, you should feel that arch of your back lift off away from your hand. And if I were to say pelvic tilt back, you should feel that back come toward your hand, flat kneed against the wall. Okay? So forward and back. Those are your key, your hand will actually be a key gauge for yourself. Okay? Now, once again, if you have any question.
Okay. All right, that was a lot to go through. Do you guys have any questions on that? You might have, since it's being recorded, that's something you might want to go through over and over again. If you guys have any questions about it, we could probably do another session on that too. That itself, when I go through this with patients, sometimes it's difficult for some folks who don't really have that pretty good sense of mobility or knowledge of it that I actually have to go through. But that's called a pelvic tilt exercise. And then again, it's an exercise not to create strength, but it's an exercise to create mobility. It also gives you more of that awareness of your core muscles too, from your abdominal muscles to your lower back and a little bit of your glutes also. You may even feel it too. So again, going through those motions, it's like a wave motion. It helps with mobility. You might also find a way to actually, if you put it to one motion that actually feels comfortable for you, it's a great thing. I did that over the weekend on a drive to, to a drive-through safari for my, for my son and nieces. I mean, I was on the car for over 4 hours and I couldn't get out of the car. And that's a very typical situation for a lot of us. So guess what I was doing? I was doing those motions and I held to a certain position where it started to relieve a little bit of it too. Okay, so these are some key things that you could start doing also on your own. Okay, questions on that? All right, a young lady here also had asked about travel pillows. Yes, I do like travel pillows. Those round ones. Why? If they're nice and they're soft, they're comfortable, but also firm enough, they're protecting your neck from dipping down this way, especially if you're traveling. You don't want that. That's why you're going to have a lot of stiff neck or bending it different ways. So yes, it's a good thing to have. I use them too when I travel. Okay, so let me just see. Are there any questions? I'm trying to go through a good time here. We're good? Okay. So let me just take a quick peek at this one.
Again, this is Dr. Chris.
Let me just see.
We're now at a moment that they're not
Okay, so now this is actually important. Okay, for those of you guys now, let's say you're doing great, but you're at a point now where it's like, well, what can I do to get my back stronger? We're gonna start working on your core. These are some very basic core stuff already. Now, in order for us to do this, we're not just gonna do sit-ups. We're not just gonna do back extensions and all that, right? What you see in the gym. We're gonna get into what we call establishing spinal neutral. When I'm talking about spinal neutral, we're talking about how your spine is an excessive curve or reverse. You want to get it to where it's neutral, but comfortable for you, enough for you to do certain movements and core activity. And that's what I'm going to go through right now with you. I can't do it here at home right now, but I'll do it here on my rehab area.
So I'm going to give you some of my other basic moves for lower back and core development. So we just talked about the other segment, pelvic tilts. Well, the big thing I want you to also understand is trying to find that pelvic neutral or spine neutral for yourself. And what I mean by spine neutral, you don't want to be in overextension or overflexion either. You want this. We're now at a moment now where, let's say you got yourself out of your pain, like above the core. You want to develop the core intrinsic muscles of your spine. Now, what are they? They're not just your abs. Yes, part of your abs, which is your transverse abdominis. One up this, one standing this way. We're also talking about your glutes, all the different types of glute muscles here, as well as your lower back muscles, such as your lower spine, multifidi, which is further inside. All of these helps with creating strength within your spine, your inner core. Okay. One of the things I like to do is getting into the pelvic tilt, finding a neutral spine, and a couple of things I like to do. I like to do what we call the bridge. Some workout areas, gym areas, that it's called the hip thrust. Much the same movement, entails with hinging and also creating strength of your pelvic core. So let me go over this again. Pelvic tilt. We're going to find neutral. So we've already talked about forward or anterior pelvic tilt and posterior backwards posterior pelvic tilt. Now, in those areas, we're going to find a spot that's neutral, that's comfortable for us to work with, for you to work with. Okay, so it's not overextension, not a reflection, but something where it's comfortable. So for me, it's here. Spine is neutral. We're going to imagine our abdominal muscles or stomach muscles here as two doors. I want you to go ahead and close it in. Now, when I say close it in, yes, you are going to activate. You're going to slightly tighten it up. But you don't want to do it to a point where you're straining yourself, where it's hard for you to breathe or carry a conversation. You want to just activate it. Next is, we're going to hold it as we're in spinal neutral. We're going to tighten up your glutes, like you're trying to pinch a penny between. I know that sounds funny, but that is the actual motion you want to try doing. Okay. Next is, I want you to think about your whole entire muscles around your spine to tighten up on your full core set. Okay. So the muscles in your lower back, you want to tighten up, but you want to push against outward, against what it can't.
Okay, let me just continue with that. So I'm going to go with the second video here, but I'm going to emphasize this too. When we're doing this, forward, back, neutral. Your stomach muscles, you want to think about two doors closing in, okay? You don't want it too tight that you can't have a conversation. Your glutes, you want to squeeze them together like you're pinching a penny in between. I know that sounds silly, but that's actually the truth. The lower back muscles, this is a little bit tighter, a bit tougher now. Think about the muscles here. You want to kind of push them out. So that takes a little bit of timing and knowledge also. If you could actually press your fingers against it and try to push your muscles out towards it, that's the idea, all right? If you don't get it right away, that's okay. But if you get 2 out of 3, that's fine. I'm gonna move right into this now.
It takes a little bit of time to get used to, but once you get used to it, you can actually do it in command, but actually push it out. So it's very, very subtle movement. So once again, tighten it up, it goes to 2 doors. Tighten the glutes like you're pinching a penny, and as you maintain spinal neutral, and lower back, you want to push out against your fingers. Okay, I'm gonna hold it there. Now I'm doing this standing, but I'm gonna do this now lying down. Okay. So as I'm doing this, finding pelvic neutral, boom. Tighten your core, so forward muscles in the front. Activation, glutes, activate. Knees not shoulder apart. Okay, we'll get to that in a second. Now your lower back muscles tighten up, you're pushing against your hands. Perfect. We're now going to get into the bridge. Now, first things first, if you can help it, cross your arms. If it's tough for you, you put your hands on the side of the table for now. But as you're maintaining pelvic neutral, really working your core, you're gonna really use your glutes to push down towards your heels of your feet into the bridge. And maintain core, forward, activation, and down, up, and down. You put the hands across your chest, so now you have more focus on your core. Okay, and this is what we call bridge. In a lot of gym circles, they call it a hip thrust. You might see some folks even putting more resistance, such as a barbell weight. You don't have to get into that now, right? This is just really for you to really understand your body better, how to activate your muscles, how to do it properly, cautiously as well, and to just start doing certain exercises too, okay? When we're talking about core, people think about doing full back work or crunches. I mean, yes, they do work, they're helpful, but again, that's more of a higher level too. Okay? If you're hurting your back or just coming from a back injury, want to do it safely, this is a good start. It's what I typically do for a lot of folks, especially in the very beginning. Again, any questions, don't hesitate to.
Okay. All right, that was a lot there. I hope you guys got that, okay? Spinal neutral, core activation from all 3 parts. Your front, your butt, and your back. And then to the bridge. That's what I typically start people off with because it's simple, yet challenging. And you could actually do this on your own. You don't need weights for this. You don't need resistance bands. This is a great core activation exercise that you can do on your own. Some of these stuff looks a little silly, but to be honest with you, you're doing workouts, you're doing exercises. A lot of other stuff you see around, they look silly as it is. This is actually a very helpful thing that you could start doing. All right, now let me just make sure. Okay, so the rest here are pretty much more add-ons and alternatives here. Anybody have any questions so far? I know I'm going through a lot here. Dr. B, do you have any questions too?
Nope, this is all great stuff that I'm relearning and learning new stuff, and I can't wait to use all of them. I'm gonna have to, if it's okay with you, I'm gonna have to post some of these videos so we can do it after,
Yeah.
if that's all right with you. Okay.
Absolutely, please
Okay.
post them up. You know what though? I went through a lot of things. You're not gonna remember everything, especially the small visual verbal cues I've given you guys. So you're gonna have to listen to it over and over again and practice it too. But I'm gonna just show you a few things here. Now, I know I'm in my rehab area, I have my exercise equipment, but you think about this too. You can also use resistance bands, any type of retention bands at home. This is something that's actually good for your postural work also. Now, don't get intimidated because of all these weights and cables. Just think of them as really more so of just cable bands that you could attach to a door or a post. And see what I'm trying to do is I'm trying to activate the muscles in your back here, okay? Now I'm not trying to get big as a rock here, but what I'm trying to do is open up the rest of your whole thoracic cavity here. That's to really emphasize that whole posture instead of doing this. Other things that we could do for your neck. Let's say, no. Okay, I went a little too far ahead there. All right. Other things, I'm gonna go a little skip ahead here too. Things for your neck. If you have a resistance band, all right, you could pull it across safely. Just please be careful with the resistance band on the sides or the corners. You could do those resisted chin tucks also. All right. That's something you could do too. A little bit, I call this a Karate Kid, where you could wrap it around. The reason why I have it wrapped around is because once you pull it forward, you're automatically activating your muscles to do a chin tuck. And you're actually using one side at a time, and that's actually causing resistance and rotation. So this is a little bit more advanced, but for some of you guys who want to challenge yourself and you have minimal amount of pain in your neck, that's why I moved to the side there. Doing it one side at a time, that's actually causing resisted rotation as you're doing a chin tuck. That's what I like to do for a lot of folks. Okay, it's for the neck. And again, if you, let's say you want to go a little bit more minimalistic again, a towel, a pillow, any of these little dodgeballs that you find in the drugstore, you could do the same thing. All right. Obviously added more resistance, a little more challenge here too. So it's a little bit of instability. As you can see, I'm actually adding a little bit of rotation and extension also, such as that. All right. Very common thing that I typically prescribe to patients to do at home, even in the office. All right, so that's neck stuff. I showed you upper back. Here's extra stuff for your lower back. If you can, I'm gonna go into, most of you are, or if not all of you, or maybe willing to, get a physio ball. One of the cheapest and most effective exercise equipment. This is what we call stir the pot. So I start off, again, in the beginning, spinal neutral. You can start off with your knees on the floor, forearm and elbow onto the ball. You're gonna roll it out a little more forward. So you're gonna feel, it's a plank, it's a moving plank. And I do stir the pot. I'm going right to left. Now, as you can see, I actually extended. Now, if you want more challenge, you can put your feet further out. So you're now doing a full extended plank. Now, for those of you who haven't tried this yet, and you're going to feel a lot of good core workout activity with this. All right, so also be cautious about it too. You know, I usually start off maybe a set of 10 or so, both sides, clockwise and counterclockwise. Ooh, can't wait to try this one too. Yeah, I love doing this in the gym. I love doing this at home. I love doing this at the office when I have a break. So really good core activity there. Okay, very simple, very effective. You don't have to go crazy. You don't have to do a lot of million crunches. That itself could develop a lot of strength. This one, if you have things like the TRX or a resistance band, this is called a peel-off press. So with the peel-off press, I'm just gonna stop right here. You're actively resisting one side. And what I'm doing right now standing, there's so many different variations. You're keeping your hands at midline and you're extending it forward and back. All right? You're gonna really feel it as your body's withstanding that anti-rotation or that rotation. Other variations to that, you could do this seated on the physio ball. Now you're working with a little bit more balance work. So again, for those who have access to resistance bands also, you don't have to worry about the fancy cables. Same thing. And if you really want to challenge yourself a little bit more, half kneeling position. You're really going to challenge your core, your glutes, everything. So it's a little bit more of that progression. Okay. There you go. All right. So, all right. Try to do this within an hour. Okay. You're welcome. Do you guys have any other questions right now about this stuff? Hope it's straightforward.
Yes, Chris, this was great.
Yeah,
And
good.
So yeah, I just wanted to add a couple more things before we end out. And if you have any questions while I'm talking a little bit, you can add them in. But I'm pretty sure we're gonna, if you have questions for any future discussion, maybe I can coax my little cousin into doing this again, because this was so great. There's so many things that I was like, oh wow, okay. And I also am very proud of you.
Thank you.
So I haven't seen you in a while, and it's so great to see what you've been up to and everything. And before I end, I just, some of the people that are watching that I see have asked, what can we do in terms of fueling good muscle, muscle for good health? And like Dr. Chris said, the best thing to do is keep the muscle moving, right? So, and also lots of water and hydration. So one great thing about drinking a lot of water is that you have to get up to go to the bathroom. So when you do that, that's what Dr. Chris is saying. You're getting up, you're moving, you're going to the bathroom, maybe getting more water. So while you're at your desk, definitely always be getting more water and drinking. Now, if you don't want to drink just water, don't go for the Gatorade, don't go for those things high in sugar. Go for good things that are low in sugar, things that are like that are going to fuel your muscle and not cause more lactic acid buildup and cause more what we call like anaerobic respiration, right? Remember, I talked about that before. So more water, more oxygen, things that bring oxygen to the muscle. So I know some of you have asked if we had any Arbonne products that do that, and we sure do. And just quickly with that, we have what's called our PhytoSport line. And I just like, there are 3 different ones, but this is our Prepare and Endure, which is the pre-workout, and then the complete hydration, which is during. You put this in some water, you drink it. It's much better than drinking any of the stuff out there with a lot of sugar. These are not intended to diagnose or treat or any of those conditions, but it does help muscle health. And what it does, it has cayenne that helps support blood flow and good circulation. It has ginseng that supports energy and physical capacity and performance. And it also has turmeric, which helps the joints. The Prepare one has some amino acids that help, specific ones that help bring oxygen to the muscle. And then the Complete Hydration has a blend of 6 electrolytes like magnesium, potassium, calcium, things that you get lost when you're exercising. And then at the end, if you still have sore muscles, and this is not like a menthol type thing, it's a gelée, it's a little bit of Ayurvedic medicine self-care, and it helps it has lavender and juniper oils and orange peel oil, tangerine peel oils rather, and it helps to soothe and calm the muscle overnight. So those are just a couple of things. I know some people have asked, so I wanted to add that. And with that, I do want to thank Dr. Chris. I mean, he really put together such a great presentation. I'm eager to watch all the videos again because they were really, I mean, you just got a whole seminar's worth of stuff for free. And it just, I have to say, from a personal standpoint, like I said, I'm just so proud of you. I'm just beaming with pride watching you do what you do, what you're passionate about, and caring for people. And I really hope you come back again because I thought this was really informative and empowering and amazing. So thank you so much for taking this time to do this.
Welcome. Yeah,
I hope you had fun.
I had fun. I mean,
Okay.
this is great. I love it. I love talking about this stuff. You can't, sometimes you have to stop me from talking so much about it because I just keep going and going. But again, I try. Hopefully, I got everything succinctly.
Oh,
And
yeah.
so, if you have any questions, you can feel free to reach out to me. Feel free to reach out to Dr. B. I'm here at your disposal also. If there's anything you want me to talk about also, that's, sports science too. Obviously, she's got great products with the Arbonne line. They're awesome products for nutrients and everything. These are all, they all work hand in hand here too. Especially now during this time when we're trying to be a little more health conscious, especially with all the crazy things going on. It goes hand in hand.
Definitely. And like I said, if you have any ideas of other things that you may want to hear from Dr. Chris. You can post them. This video will be up on the page, and then I can also have a shareable link to it as well, so that Dr. Chris can share with his patients as well. But I just want to thank you. Really, you put a lot of work into this, a lot of thought, and I really appreciate it. And I know I see from the comments everybody's loving it. So
Good.
thank you, cuz.
You're welcome, guys. And guys, thank you for having me, and it's a pleasure. I love talking about it, and I just hope that you guys are all safe, all well, and this could be a great tool for everybody.
Thank you. We're going to have you back, so don't go too far.
Oh, now I'm here.
All right. All right. Thank you, everyone. Have a good night. Talk to you soon. Bye-bye.
Bye.